Hello, happy Saturday. I was about to say Friday. It is actually Saturday. Thank you so much for joining me for Profiles with Paulette Payne. This month, of course, as we all know, is Breast Cancer Awareness Month. And because this topic is close to home, I have family members who have been diagnosed. Thank God they are surviving and not battling the disease. However, there are so many that are still battling. And so tonight, we're going to focus on the survivors while we remember those who have lost the fight and those who are journeying still. We have a great lineup of guests tonight. Each of them have a tremendous story of resilience, of strength, and of courage. I can't wait to share their stories with you. But before that happens, just be mindful. There has been a tornado warning issued for my area. In the event we're told to take cover, I'm going to have to take cover. We're going to have to sign off and possibly bring this back on another day. Also, as you watch, if you feel inspired by the stories that are shared, please feel free to share the video, the live broadcast on your Facebook page and throughout your social platforms, because the mission of Profiles has always been to inform, inspire, and empower. And so tonight's show, I'm sure, will be no different, and I hope this is your experience. And so now we'll go on and get started with the show. Again, like I said, we have some amazing warriors tonight that will share their stories of survival. We have Marilyn Dixon, Donna Long, Jennifer Nash, Brett Miller, who is the co-founder of the Male Breast Cancer Coalition, as well as founder of the Brett Miller 1T Foundation. I'm really excited to hear his story because, again, male breast cancer is something that's not always discussed. And so I definitely wanted to make sure we have the other side of this equation, if you will. And also we'll be joined by board certified surgeon, owner, and CEO of Just Breasts LLC, Dr. April Speed. She'll be joining us shortly. She is doing one engagement and she'll hop on to this as soon as she's done. But while we wait for her, as you probably know, today is National Mental Health Awareness Day. And with any diagnosis of anything major or small, we all tend to go through some type of mental health crisis, if you will. And that's nothing negative. It just simply means we're trying to digest and break apart, if you will, the information that we've just received. So mental health, of course, it has this negative stigma in terms of treatment. And so we want to abolish that stigma, certainly acknowledge the importance of strong mental health. And I'd like to talk with our guests tonight to find out what type of mental challenges did they experience when they were diagnosed, whether it be depression, anxiety, worry, whatever the case may be. But before we get to that, I want them to each share with us when they were diagnosed, the stage at which they were diagnosed, and then how long they've been cancer-free. Jennifer, we'll start with you. Jennifer?
Trying to hit unmute. Good evening, everyone. My name is Jennifer Nash, and I was diagnosed with stage 3 triple negative breast cancer in July of 2019. Technically, I'm not cancer-free as I'm still going through the final stages of my treatment right now, but all of my major treatments are over. I had a partial mastectomy, and I have full chemo treatments and radiation. Right now, I'm just on a maintenance pill right now just to get me through the final phase of my treatment. But as of my last scan, the cancer looks like it's gone. So I'll celebrate that and I'll get confirmation at the end of this year. But I'm a fairly new survivor. But I'm happy to be in the company of these wonderful folks.
Congratulations, Jennifer. Brett.
I am Brett Miller. I am a 10-year breast cancer survivor. I founded the Brett Miller 1T Foundation and co-founded the Male Breast Cancer Coalition. Our biggest goals are to raise awareness in men and the youth as well, because it seems to be a younger and younger diagnosis that, you know, breast cancer is possible at any age and any sex. It does not discriminate. I am 10 years clear. I was 24 when I was originally diagnosed, but I was 17 when I first found my lump directly under my right nipple. It was barely stage 1, and I had 4 rounds of chemotherapy and a single mastectomy.
Brett, I look forward to hearing more about that experience. Marilyn, what about you? Unmute yourself, Marilyn. All right, Donna, while we wait for Marilyn, tell us, when were you diagnosed, what stage, and how long have you been cancer-free? Unmute yourself. Donna, we can't hear you.
Can you hear me now?
Yep, we got you loud and clear. Okay,
I was diagnosed a month and a half before I turned 40. And I was like the early stage of stage 2 breast cancer. I had a lumpectomy and did 33 rounds of radiation. And I've been cancer-free for 3.5 years now.
Congratulations. Congratulations. Marilyn, what about you?
Hi, I'm Marilyn. Thank you. I was diagnosed with stage 2B, HER2 positive breast cancer on August 1st, 2016. And my procedure included a lumpectomy, 8 rounds of chemo, and an experimental treatment of radiation that lasted about 4 weeks. And as of now, I am celebrating 4 years of being cancer-free.
Congratulations. You know, I feel so humbled to be in your presence tonight because there's so many who have a different story to tell, you know, and to know that many of you, or each of you, are coming through this courageously and are sharing your stories to inspire and encourage others truly is an humbling experience. Brett, talk to us about any types of challenges from a mental health perspective that you experienced when you were diagnosed, and also walk us through the moment that you discovered your breast cancer.
Yes, I wouldn't say that I didn't have any, luckily, any mental health issues with it. It was more so just not, you know, kind of that not being included, or being told that, oh well, this is just it's just for women. It's only women's disease. It's only 1%. And the statistics this, statistics that. It's like, but I got diagnosed. I am full on in breast cancer right now, and you know, just that inclusiveness that just constantly was, you know, not there. And it still doesn't feel it there today. We're making some strides with the Male Breast Cancer Coalition, and getting in research and starting to get some of those big foundations, organizations to acknowledge men, but it's women. I get it. I totally get it. More women are going to be diagnosed than men, but it's not just a women's disease. It's a people's disease. It doesn't matter if you're, like I said earlier, if you're male or female, you can still get breast cancer. I was 17. I was in my senior year of high school, and I was just watching TV and kind of did like a stretch and reached across and just kind of, you know, scratched, and I felt this lump directly below my right nipple. I went to 2 different doctors during my senior year. One was for a physical to play sports, and the other one was to get my shots for college. I mentioned it to both of those doctors, and almost identical was, it's a calcium buildup. You're going through puberty. It'll dissipate, go away. I wouldn't worry about it. I had it for 7 years when I was, you know, officially diagnosed in 24, and there wasn't any signs per se that that made me go. Like, I wasn't feeling sick. I didn't have any other symptoms that I knew about. It was just my parents being like, you know, you've had health insurance for, you know, a year and a half, almost 2 years through your job. You know, you haven't had a physical for a while, so why don't you, you know, set one up? And then they asked, they're like, well, do you still have that lump? Knowing they knew about it. And I was like, well, yeah, it's still there. It's never really gone away. It doesn't bother me. I never told them really that for almost a year and a half, if I had squeezed the nipple or if I bumped up against something, I did have a discharge from the nipple, knowing that is a sign. But I thought that was the calcium buildup finally dissipating and going away. So I didn't, just being a male, it's one of those things that we're also trying to change for men is go to the doctor if something feels off. Quit being so stubborn. We are very stubborn when it comes to our health. A lot of us don't go to the doctor when early signs arise, and we should. But I was diagnosed at the age of 24. I had to go through the a sonogram at the women's clinic. Did not know I was going into the women's clinic. Was handed a pink gown and greeted by name when I actually walked into the women's clinic. I don't know if very many women get that when they go to the clinic for the very first time, but apparently I was the only male going in there for the day, so they knew it was me. Had a mammogram at the same time because the female doctor that was there that did the scan, she kind of did a triple take on the scans and the monitor, and kind of disguised it with let's just do a mammogram just so we don't have to waste your time. You have to come back in and do this all over again. We can have it now, and your doctor can have everything that they need. And they took the lump out. Not the doctor didn't say that it was cancerous at all. Next day is when I get the call that it's breast cancer. He hasn't fully read the pathology reports, but he will go through them and get back to me in about 3 to 5 days. And that was it. There was no are you sitting down? Hey, you should come in. I don't know if movies and TV shows are actually like that. I don't know how everybody else got the call. But I just thought that was so abrupt and fairly rude that, that's how the phone call came. And it upset me even more because I signed the HIPAA paperwork for him to discuss anything with my parents if they were to call after I had, told them everything. And his excuse to why he didn't or why he refused to give them any information was, well, he's 24 years old. He's a man. He can deal with it. I could, but I couldn't. I was 24. I was a male, and I was diagnosed with breast cancer. Hearing those words, it's just, it makes you just going to sit there and think, is that, how is that possible? But, we left that doctor, second opinion, and went from there. And the new doctor that I had, the surgeon that I had, he was part of the reason why we started the Brett Miller 1T Foundation and the Male Breast Cancer Coalition, because he told me that he saw something in me, and if I was willing to share my story, he saw that I could help others. I could put a face to male breast cancer and just be there for others. And here I am today.
And that's so important. The piece about you being a living testimony, if you will, regarding this disease, because there's so many people out there who have walked this path or who will walk this path, and certainly to be a male and having to go into a women's clinic to receive a mammogram, that's one stigma that men have to break through. And the whole issue around, for the lack of a better word, the ego, and that's not a bad thing, because there aren't many men who come forward, if you will, to share their stories. And so you don't have that history. You don't have that information to rely on and
it's just statistics. The numbers, I think, are totally off. I do not believe it's 1% anymore. It's definitely higher than that, but I don't know if they're not getting reported, or just the men don't want it to be reported. However, I don't know, but the numbers are off. They're higher. But we just need, it's more so the inclusiveness. If we can get big pharma, if we can get the major foundation organizations out there to stop saying only women and either say women or men or people diagnosed with breast cancer, then I think more men would feel more inclusive. Some are saying that it's pet cancer or chest cancer. That's not the medical term. The medical term is breast cancer. It's attacking the breast tissue. Right. And you know, I struggled with it a little bit. You know, it took a little bit. I met with a plastic surgeon to see if I was going to do reconstructive surgery and whatever. But hearing from him that I would have been the first male that he would have performed a procedure on, he wasn't really sure if it was possible or not. But, you know, he would really do his research if it was. I didn't really feel like being too many people's guinea pig. Mm-hmm. So I was just like, I'm not going to do reconstructive. This, you know, the scar, this is my story now. This is what I'm going to speak about. This is what, you know, when I say that I have breast cancer, I've had breast cancer, and somebody goes, "You're a male. That's not possible." I lift up the shirt and I show them. I know for women, it's not the easy thing to do. It's very personal, and I totally get it. And I just feel that sometimes people don't believe you when you say it. So I just want to, you know, prove them wrong. And
well, thank you for the courage. Yeah, no, thank you for the courage to be that voice, to be that example. It certainly will go a long way for sure. Marilyn, talk to us briefly about, did you ever experience any anxiety, any depression, any mental health roadblocks, if you will, when you received your diagnosis? What was that journey like for you?
As you mentioned, Paulette, it was really a bit of anxiety there. And actually, I had been diagnosed with depression for years. Just postpartum seemed to never go away when I had my oldest daughter. But hearing that, and you know, the first thing that comes to mind is, okay, this is possibly terminal for me, you know, and I had to really just center myself. I was just getting ready to go back to work because I'm a school teacher, and I went and had my mammogram. I get a lot of stuff done during the summer, and luckily I picked up my results, and my primary physician was in the same building. And so the way that the technician gave me my results really sort of gave me pause, because she didn't know if to put it in the envelope or she didn't know to just hand it to me. And she says, "Well, you're going to see it anyway. Good luck." You know? So I was like, okay. And so I walked over to my primary physician's office. I didn't have an appointment. I'm standing there crying, saying, okay, I need to see somebody right now about this. So my primary physician, you know, she talked to me and told me that this is a possibility. This is what they say may be the case. However, you know, we got to investigate it. So she referred me to an oncologist, and I went on to actually have the biopsy done, you know, and found out a few days later that it actually was cancer stage 2B. And I will say to people, you know, I never had any pain in my breast area, but I had this general malaise or dis-ease for about a year. And I ignored it, but it was nothing that stopped me. I was able to function. It was almost like, you know, a pretty hard belch or something. It was just something in my body that wasn't right, but because it didn't stop my ability to function, I just kept moving, you know. And then it was because of that, you know, Thursday in July. And I just remember going over to my, you know, general physician's office, and I called my mother and I called my ex-husband, and it was just like, okay, two people that really know me, know what's going on, and I got to get going with this, you know. So it takes a toll on you. It really does, you know, and anyone who says otherwise, I don't know about that, but it gives you pause, and it causes you to question and look at everything in your life through a different lens.
Mm-hmm, mm-hmm. For sure. You know, I just recently had my mammogram, and ladies and men, now is the time. Of course, you don't have to wait until October to get your mammograms, but it's easier because Breast Cancer Awareness Month. So I got my mammogram, and all the while I'm like, oh my gosh, please let it come back normal. Please don't let anything abnormal show up. You know, that's the kind of coaching I had to give myself. It doesn't run, well, it does run in my family on my mother's side. So there's the possibility there. But anyway, yeah, I can totally relate to that, Marilyn. Donna, quickly tell us, any challenges you experienced once you received your diagnosis, and walk us through your discovery. What was that discovery phase like? Did you find it doing a self-check, or was it just part of your annual procedures that you get done each year? Talk to us about that.
I actually just went in for my first mammogram, and when I had that done, they said they seen something. So I did an ultrasound, and they said they seen something. I would need to do a biopsy. And then when they did the biopsy, they told me they're pretty sure that it was cancer. And I got a call like 3 days later saying it was cancer. So I was kind of already prepared that it probably was going to be that. And thankfully, I was pretty busy that year when I was diagnosed. It didn't really hit me till like a year later that I actually had cancer. I was in the process of adopting 2 little children, so my focus was on them. And it didn't hit me till like a year later. It's like, oh my gosh, I had cancer. And
when you say it hit you, what were those moments like? Were you concerned about, your mortality? Were you just concerned about finding time to carve out for your treatments? What was
no, I did the treatments like a month out. I did have my surgery in February, and I started my treatments right away. And I did all that. It never really hit me till I guess after I adopted my children, I was able to relax a little bit, and then it's kind of hit me. And now that every time I get a mammogram, I'm thinking, is it coming back? And I do an MRI too, once a year too, and I keep wondering if it's going to come back.
Yeah, I can't imagine that anxiety, but it's good that we now have the tools, and we've had these tools, but in terms of getting the exam, doing self-checks, staying on your physicians, because I always say your best representative, your best healthcare representative is yourself. You know your body better than anybody else. And so it's critical that we do our self-checks. It's critical that we do our annual exams, just to make sure we're in the clear to the degree that those self-checks will help us know that. Dr. April Spencer is now with us. Dr. Spencer, thank you so much for taking time to join us tonight. We've been hearing from our survivors, and two of them have shared experiences where there hasn't been the best bedside manner in terms of sharing the results of the diagnosis. Before we get to what's important for doctors and techs to know and to do, I'd like for you to just briefly talk to us about the whole mental health aspect of receiving a cancer diagnosis, because of course today is National Mental Health Day, Mental Health Awareness Day. So I wanted to certainly weave that part in terms of receiving a cancer diagnosis. Can you talk to us a little bit about that?
Oh, sure. Yes. My name is April Spencer. I am a board certified general surgeon. I did my fellowship in breast surgical oncology at MD Anderson Cancer Center out in Houston. And so I'm now in Atlanta. And I've been doing this for about 17 years, Paulette. And I have to tell you the stories, unfortunately, of Marilyn and Donna that they shared. And I'm so sorry, Brett, if I hadn't had opportunity to hear your story, but are very common. And a lot of women and men that come to me for, let's say, a second or third opinion, it's not that they want to hear something, want to hear the diagnosis any differently. They just want more compassion and more customer service. Because people just want to be seen. They want to be validated. And so it's incumbent upon us as clinicians, whether you're a surgeon or the medical oncologist, or even the technicians, to make sure that you are managing the messaging with dignity and with detail. Because most people know the journey is difficult, but they need to walk away inspired and feel empowered that it is doable. With a great team and a wonderful attitude, you can get through anything. But that's essential. And so oftentimes you may hear your attitude determines your altitude. Like that's so true. Like you've got to will your body into health. But a big part of that is from a mental standpoint, you've got to be motivated to know that, listen, I have a team of people behind me, but also have the courage to leave that team and seek another opinion if you're not rowing in the same direction, if you feel like you're not validated, you feel like you're not being listened to, and no one wants to feel like they're just a number. And so I want to encourage those that are listening and thank Marilyn and Donna for sharing their story. But those are the stories I hear way too often, where women come to me with diseases that have progressed, where they were diagnosed a year or two ago or more. And they say, listen, Dr. Spencer, that technician was like, hey, you have cancer, good luck. I mean, some of the things that I've heard is just unconscionable. The lack of empathy and the lack of professionalism and compassion. I mean, we're in a business of service. Like, your patient is your customer. You are there to serve. It's customer service. So I want to applaud them for still being courageous enough to go through their journey, even though their teams may not have been rowing in the same direction in terms of knowing the importance of having compassion. And even like with Brett, when I have a male patient that's diagnosed with breast cancer, they are always, always, always scheduled as the first appointment of the day or the last appointment of the day, because I want to infuse that dignity. I don't want anyone walking up to my male patient saying, are you waiting on your wife? Or are you waiting on your daughter, your partner, whatever? I want them to be in a setting where they feel like they are valued and not just assume that they're there for a female, be there as a caregiver for a female that's having a workup done. And so you have to institute these things in the healthcare system so that you give people their power back. You want to put patients back in the driver's seat. And a big part of that is being inspired by your team, knowing that they have not just competency, but compassion. And so Mental Health Day is a great day to have a conversation about this, because that's the cornerstone. You've got to feel good to know you can get through, and a big part of how the message is communicated so that you can be motivated to do what's necessary to get through this journey.
That's very critical. That's a very critical point. And Dr. Spencer, two of our guests were diagnosed with 2B breast cancer. I hope I said that correctly. I think that was Jennifer, and then triple negative breast cancer. Can you talk to us, Dr. Spencer, about the variations of this disease and how they might present themselves?
Sure, absolutely. So 2B just represents the stage. And so a stage is based on three main factors. We call it T for the tumor size. And so that gives an idea of the stage. The N is lymph nodes, which are located underneath the arm. And lastly, M as in Mary is for metastasis. And so when you put all three of those components together, you get somewhat of what we call like a score or stage. But thankfully, we're doing a lot of research, and how well you do is not always contingent upon your stage. Like, okay, the lower the stage, because stages go from 0 to 4, we cannot always assume that the higher the stage, the worse the prognosis. What we're looking at now is like tumor behavior, tumor biology, so that we can get a better understanding of unique specific treatment options regardless of the stage. So I don't want anyone out there to feel discouraged, like, oh my gosh, I'm not a stage 0-1, I'm a 2B, or I'm a 3C, or I'm even stage 4, I have metastasis, so my life is over. Absolutely not. I think the best thing is just to work with the care team to come up with a unique plan to get you through that journey regardless of the stage. Now, in terms of triple negative, triple means 3, and negative means the absence of. So there are 3 main receptors that we target medically to be able to turn off the stimulation of cancer. So let me just say this first. A lot of times women and men will come to me, it's like, how did I get cancer? Like, I eat well and I exercise. I don't know if any of you all have had those questions in your mind. I don't have a family history. How did this happen? And I have to remind them from a biology standpoint, Paulette, we make cancer cells every day. But our immune system is responsible for doing 2 things: recognizing the cancer and then destroying it. So if our immune system isn't working properly, it will allow those cancer cells to grow unchecked. So the question is better framed, not how did I get it, but why didn't your immune system recognize and destroy it? So I have a conversation with patients about building their immune system, setting their bodies and their minds up for success moving forward. And so the cancer cells continue to multiply and grow unchecked. So I look at the cancer like a light, and the receptors, the 3 receptors, are the light switches. So you want to turn off each receptor because you want to turn off whatever is stimulating that cell to keep growing. And you may say, well, conceptually, you kind of want things to grow because growth seems positive, but in a cancer setting, that's not a good thing because everything has a cell death and a cell life. It's like a cycle, like platelets that help us clot, 7 days. Red blood cells, 120 days. Ovaries, 28 days. So everything is seasonal, even in the body. But cancer cells, they have no respect for time and they just continue to grow. So when one does not have the receptors, it's more difficult to turn off the switch that has this light, the cancer on. So when one doesn't have the 3 receptors, the medical oncologists oftentimes have to use other medications that may not be as effective because you don't have the switches. So it's not impossible. So similar to if you had an electrician, if you wanted to turn off a light right now, we turn off all 3 switches: estrogen, progesterone, Herceptin. But if you don't have it, the electrician may have to go behind the walls or take out drywall to disconnect the wires. So it just means that when you lack the switches, it's a little bit more challenging. But again, I don't want women or men to be discouraged. If they have triple negative, it's more common in African-American, Hispanic women, that there is still treatment options out there. We just oftentimes have to be a little bit more creative in our approach.
Right, right. That's really critical information because, you know, before I did a show some years ago around health, you know, wellness, and Dr. Spencer, I actually interviewed you some years ago, and one of the stories was on breast cancer, and I went into the story just thinking, oh, yeah, breast cancer. There's no variations in the disease, and everything's the same, but it's far different from that. It's definitely it has its cycles and it has its variations, and I didn't know that, and so that's important information for our guests to know. Jennifer, talk to us about what's life been like for you since the diagnosis. What has life been like? Have you been able to resume that, you know, your normal activities? Is this a weight that has been lifted? Walk us through that.
So first of all, Dr. Spencer, I love you already. And anybody else I know that's diagnosed, I'm sending them straight to you. You have wonderful bedside manner. I can tell just from this conversation. And I'm the wonderful triple negative patient who my breast surgeon, she said, your cancer has a mind of its own. And I was like, okay. So I get it. So I will say that, you know, for me, I can't speak for everyone else, but when you get the diagnosis, it's like your life is immediately paused or shifted, right? So all the plans that you had moving forward, everything that you thought you were going to do, everything is on hold, right? When you initially get the diagnosis and you go through the treatment plan with the doctor, they sort of explain to you, you know, what you'll go through, how you feel, how your body may react. And they try to walk me through like how to maintain my normal life with slight adjustments. So for me, I went through chemo first. So I went through 14 rounds of chemo. The first 4 rounds were pretty heavy doses, which, you know, knocked you out. You know, I had the nausea. I was exhausted. Of course, I lost all my hair. And so sort of that first stage, it was an adjustment for me because my, you know, you had to take days off from work. So it was a huge adjustment. The remaining treatments were lighter treatments. So I was able to sort of kind of get back to my normal life. I was able to work on a pretty regular basis with minor, you know, interruptions, didn't have the bad nausea, didn't experience any of the major side effects that I did with the chemo. But then another pause came when I had to have my mastectomy. So that meant that I had to take off time from work for a period of time. And then after recovering from my mastectomy, then I went into radiation, which it was a daily treatment for 4 weeks. And so that was another adjustment that I had to make. This is a horrible thing to say, guys, but COVID actually, it kind of helped because everybody's working from home right now. So I didn't have to do any shifts at work because everybody was working from home with me. And so it was a blessing and a curse for me at the same time. But I will say that, you know, I've the support that I've had from my friends and my family and my coworkers has been paramount to my journey, because I could not have done it without the folks that are supporting me, the folks that understand the journey that I'm going through. The unfortunate part about breast cancer is that it affects nearly everyone. Everybody knows someone who has been diagnosed or who has survived or who may have passed. And so, you know, once you tell people, once you share your diagnosis, they tend to work with you and are very compassionate about your journey and very accommodating to the things that you need. So, so for me, you know, the biggest, you know, part for me is, you know, not being able to travel has, you know, been, well, I guess nobody's able to travel right now. So, so that's, you know, it's an unfortunate side effect for everybody, but not being able to do some of the things that I normally like to do has been a shift for me. But, you know, I'll get back to it. I'm positive. I know that this is not a permanent situation. So, yeah, I would say that the biggest shifts for me is, you know, really just not being able to do some of the things that I normally like to do. But, you know,
yeah.
I'll get back to it. Not concerned.
and certainly you had mentioned travel. What are some other things that you aren't able to do right now? COVID aside, what are some other things that you're not able to do that you were able to do?
So right now, I'm on chemotherapy pills. I'm on a prescription called Xeloda. And one of the side effects of Xeloda is hand and foot syndrome. And so it really makes your hands and your feet like super dry to the point where it's raw. So right now, as I'm talking, it's difficult for me to make a fist. It's just really painful for me. And then also, I can only wear 2 pairs of shoes right now, my slippers and my sneakers. I can't wear any other shoes right now because it's just way too painful. So I haven't been able to walk like I normally do. I can't walk long distances, or I can't wear shoes that are too tight or have texture because it's just way too painful for me right now. And so I think for right now, that was an unfortunate side effect. I mean, everybody I think here went through radiation. That's a whole nother level of side effects that are not fun at all. But you get through it. You know, you get through it. In the moment, it seems like the world is ending, but you get through it. And, you know, and that's the biggest part you have to remember is that this is only temporary.
Only temporary. And again, it goes back to that mental health piece. We are as strong as we think we are. And so that's a critical thing that we need to keep in mind, and not just in terms of breast cancer, but in life in general. And Jennifer, you spoke on something really important, that support system. Of course, breast cancer impacts the patient, but it also impacts those that are around you, your family. Brett, talk to us about how your loved ones were impacted by this information, by this news, by this diagnosis.
Everybody was kind of shocked, but extremely supportive. Through the whole journey, in some interviews, I've had people ask, well, did you lose any friends when your diagnosis or whatever? I'm always shocked. I've heard it multiple times, and I'm always shocked when I get that question, because if I lost a friend for me being diagnosed with breast cancer, they weren't a friend ever before, so they weren't important in my life anyways. But no, I didn't lose anybody. I actually gained more support than I ever thought that I could have gotten from friends and family. But the one thing that I found to be the easiest with the diagnosis, because it affects everybody, is to have some humor in it. With losing a nipple, I joke about it as much as I can. People are asked if, when I went through treatments, they were like, were you afraid to lose your hair? And I go, I already lost a nipple. What's hair? It'll grow back. My first year or two from after diagnosis, for like Halloween, I dressed up and did something, a scar, blood, whatever around it, just to joke about it. Like, because in doing that, it made it easier for everybody else around me to ask questions of what am I going through? And they weren't tiptoeing on eggshells trying to figure out, well, if I ask him this question, is it going to upset him? Does he think that's too, personal, or has he had that question asked 1,000 times and he's just not going to ask it, or just, be upset? And I just found that humor was probably the best thing to help everybody get through it.
Yeah. And certainly you have to concern about self, but this is a communal type of diagnosis. It's a communal type of situation, and you want to allow people the opportunity to feel comfortable and not feel like it's a secret for them to talk to you about your diagnosis. Marilyn, what's the family support like? Did you lack in it? Did you gain more than you thought was available? What was that like for you?
It was actually overwhelming. And I often say it kind of restored my faith in mankind, because I had people who I had not talked to in years. And when I posted information about coming out of my lumpectomy and just moving ahead, it was just tremendous. People I had not talked to since college, my family members, my close circle, everybody was signing up to go to, treatment and chemo with me. And even long before working from home was really popular, my employer at the time, they were like, okay, we're going to work with you on this, because chemo was on Fridays for me. Saturday, I felt fine. I would actually go and give assessments on Saturday, but oh my God, Sunday, the world just fell apart. And for me, it was almost like, I thought chemo was going to kill me. Forget cancer, because the side effects were so tremendous, and I'm a person, I was fortunate. I'd never really been ill before. And to be 50 years old and to feel this poorly, nobody should feel that badly and not be dead, in my opinion, and that's just how I thought about it. But after the fourth round, the cocktail changed from my understanding. And so it got a little more tolerable. And I believe the last 4 rounds, I was actually able to drive myself to and from chemo. But I had a great deal of support, family from all over, friends would come in and visit. And, I've always had a head full of hair. So when I lost my hair, that was a big thing for me. And I was self-conscious, and I had all sorts of, rags and stuff, but that wasn't me. It wasn't natural. So I had to come to terms with walking around with a bald head, and people were very supportive and they embraced me. So, it helped me. It was a great deal of support. And I believe Dr. Spencer said earlier, you really have to make up in your mind that, you're going to beat this, that you're going to live. And I really, and of course my faith, I was like, okay, I'm going to live and not die. And I meant that. And it takes a lot of effort. And some days you feel like you're not sure, or you feel like okay, I don't know, but you hang in there and you take it one day at a time.
It's just true. One day at a time, because this is all you have right now, this moment. Donna, so you were in the adoption process, which took your mind off of the diagnosis. Have your children asked questions? How have you explained this to them? Because, again, we have the support system, and many times that support system includes young people, and many times they're not able to wrap their minds around what this means, much less an adult that has a difficult time doing that. What has that support system been like for you, and how have you explained this to your children? Unmute yourself. Donna, unmute yourself. Donna, unmute yourself.
Can you hear me now?
Yeah, we can hear you loud and clear.
They're only 5 and 6 years old right now, so they don't totally understand. I tried to explain them. We wear, different times I wear pink, and I say it's to save my breast, and they love wearing pink for that. But my biggest support group was my husband and one of my sisters. And some of my family wasn't very supportive through the journey. It was kind of hard to accept that, because I thought they would be there for me, but they wasn't. But we made it through with the support group that I had.
Yeah. When we don't get the type of compassion and empathy from those that we hold dear, it is challenging. But then again, there are opportunities for us to find solace and compassion and support outside of that biological support system. So I'm glad you found some relief through strangers, basically. Dr. Spencer, so I want to get back to this whole issue around male breast cancer and female breast cancer. Does this disease present differently in men than women? And talk to us a little bit about genetic testing and whether or not that's covered under insurance in most cases, or should women and men just rely on these annual breast mammograms and self-checks?
Sure. That's a great question. So in regards to male breast cancer, we usually see in about 1% of new diagnoses. We think clinically that it's underreported. In terms of how it presents, sometimes it can present a little differently in that most men that come to see me say, hey, I was like working out or moving a box and I felt this lump behind my chest, behind my nipple, and I think I just hit it. So it's oftentimes trauma that causes them to be alerted to something different along the chest wall. And so oftentimes in women, beyond a lump, they may have nipple discharge or skin changes or growth of lumps underneath the arm and the lymph nodes. I'm so sorry with Brad. I didn't get a chance to hear how he was diagnosed. Like, was this a lump that you felt yourself, or how did yours present?
Yeah, my lump I discovered when I was 17. It was right below my right nipple, but I was 24 when I was officially diagnosed. And it was on my own regard going to a doctor. I went through a physical, and the doctor was actually getting ready to, check me out and say, you're good to go, almost out the door before I stopped him. And I asked, hey, I've had this lump for so long. Can you look at it? When I said that is when he kind of turned around, came right back and looked at it. But part of what we're trying to change with the coalition is I understand it's like you said, underreported 1%, but I even asked that same doctor after I was diagnosed, like, would you consider starting to add a breast exam for men during a physical? I mean, for a man, it shouldn't be that hard to do a quick little, rub down and feel it. And he immediately went back to, well, it's just a 1%. It doesn't affect everybody. So I was like, so what you're saying, it's not worth my time. Even though I'm paying to be here, you're saying it's not worth your time to do a 30-second to maybe a minute exam. And it's just kind of upsetting. But it's just one of the things that we've got to try to change. I don't fault any doctor. It's still practice. You're still learning every single day. Medicine's changing every single day. So I don't fault any doctors, but we need to make sure, as well as just patients as themselves, or men and women, that the doctors are aware as well.
Yeah, absolutely. And I'm so glad you shared that, because oftentimes when a male comes to see me, they've seen 2 or 3 doctors and it's been over a year, because most will brush it off and say, oh, maybe it's your medication, maybe there's trauma. Their concerns are not taken very seriously because they're in that 1%. But I submit to you, it is still responsibility of the clinician to, even if you feel like you don't have the exam of the chest as part of your standard physical exam for a male, it only takes a few seconds to ask the question. Have you noticed any changes along your chest wall?
Yeah, exactly.
Lumps, nipple discharge, like you name it, because you can't just say global changes, but lumps, nipple discharge, changes underneath the arm. And so it's important that we initiate the conversation, because a lot of times the patient may not. You were great in that you mentioned it, but sometimes they won't, sometimes out of embarrassment, or it may just be dismissive. You may think, oh, it's, it's nothing. And then I make sure that I call ahead. If I have a patient and they have to get a mammogram, it's a male, I say, listen, I have a patient, it's a male patient. They're not coming with their wife or their girlfriend or their sister or their friend. They're getting the mammogram, just so that I can put in everyone's mindset that they've got to manage the messaging and treat this individual with the dignity and detail that they deserve with their workup for their breast cancer. So their workup, Paula, is still the mammogram. Mm-hmm. And I usually do my biopsies in my office, because it's a little uncomfortable sometimes for the male patients to have to go through like the mammogram ultrasound biopsy in the breast center. And it's like all women. And so it's just a different sort of experience. And so you want those men to still feel dignified. And he felt like his case was dismissive, like, oh, on the way out the door. And then it's like, oh, it's only 1%. I'm not going to change my practice management, which is unfortunate. But it's also a wonderful opportunity for an organization like Male Breast Cancer Coalition to get the word out and to educate the community and clinicians about the importance of, regardless of the 1% of underreported, I think is underreported.
And to we've, with HCA Midwest Hospitals, we've actually worked with them. My mom's shared in the comments, I see our breast self-exam videos, the website, the cards that we have. They've actually changed their questionnaire in their breast cancer center. So if they have a male coming in, they actually get a questionnaire that's directed towards them, not the one that I had that asked me for my name, my insurance, my address, when was my last menstrual cycle, or we've made strides in certain areas. But our biggest thing is that you're your own best advocate. You know your body best. If you feel something's wrong, go to a doctor. And if they give you an answer that you don't feel comfortable with, don't.
Somewhere else. You said that.
Third, fourth,
you are a consumer. And so you got to make sure that, you are a customer and that you are getting the best care in the most competent and compassionate fashion. And so absolutely, I'm a huge fan of that. I'm so proud of you for starting this coalition.
Thank you.
This is true. And Dr. Spencer, if you could, and we have just a few more minutes left, can you speak on genetic testing? Is that something that, is that something everyone should look into? Is it something that's covered under medical insurance?
So in regards to genetic testing, a lot of times in healthcare now, unfortunately, insurance companies look at numbers. So from a genetic standpoint, of those that are diagnosed with breast cancer, about 5% will be positive in terms of a BRCA1 or BRCA2 gene. There are lots of other breast cancer genes, but those are the most common. And so most people will not carry the breast cancer gene. But a lot of insurance companies are now covering genetic testing. So there's like a genetic questionnaire that you have to answer in order to see if it is coverable, and is based on, just having a high risk from either multiple biopsies, family history, et cetera. So they do these algorithms. But I always tell patients that regardless of these algorithms or whether insurance companies will pay for it, have a conversation with your clinician. If you feel compelled to still get genetic testing, even if you don't feel like yours might be positive for it, you can still be your own advocate and push for it and have your insurance company pay for it. And so just, again, you have to pick up the phone oftentimes, unfortunately, and you're on hold for an hour or so dealing with insurance companies, which often are in the business of non-payment, and request your genetic testing. So not everyone should get it, but I think everyone should at least be screened and have a questionnaire to see if they're at an elevated risk. And then I tell patients, listen, you may not meet the criteria, but if you want a genetic test, I'm going to push for you to have a genetic test, and I'll have a conversation with your insurance company as to why it's appropriate in this setting.
And it's so important, as you said, certainly to be your own advocate, but to have a clinician, to have a doctor that supports your concern and your desire to tap into resources that might not necessarily be needed, but because you are your own advocate, you want to take advantage of it. It's really important to have a clinician that supports that and that will go to bat for you. In closing, because we just have a few more minutes left, I want to find out from our survivors. And again, congratulations to you all as you continue on your journey to health and wellness and advocacy. I want to find out from you, what has been the greatest takeaway from this experience for you? Marilyn, we'll start with you, then we'll go to Donna, Jennifer, and then Brett, you'll close us out.
Thank you. I often think about that, but I would say this has taught me that I can overcome anything. Because the reality is you're faced with a disease that can be terminal, and in many cases it is. And it has forced me to appreciate the little things in life and look at every aspect of my life so differently. And my approach to just living is more intentional. So I think and it was worth it. No, I wouldn't choose it again by any means, but I'm not sorry for my journey. I really am not.
I appreciate that. Donna?
For me, I just enjoy life more. I think enjoy the little things more, and I feel like I'm more apt to listen to other people's stories more than before. Like, since I've never been down that journey before, I I feel like maybe I didn't pay enough attention, but now I'm trying to be more sympathy to everybody else's things that they're going
our
through.
own experiences teach us compassion and empathy, like you said. That's a great takeaway too, because not many people have that gift or that learned gift. Jennifer, what's been the biggest takeaway? What have you learned? What's the number one thing that you can take from this journey?
For me, it was don't be afraid to share your story, because you never know how it's going to impact the next person. You know, I'm a very private person, but I was intentional about sharing this story with people because I knew, you know, I'm a single woman. I live alone. So I knew I needed support, and the amount of support that I received from those that love me is just overwhelming, and it's incredible. And it's because I was transparent and I shared my story. And so it's been a huge help for me because, you know, everybody offered a ride, everybody offered, you know, to help in any way that they could. And I needed that. And so I would just tell anybody, don't be afraid to share your story.
To kind of piggyback onto Marilyn Donna's, one of my favorite quotes is don't take life too seriously. You'll never make it out alive. So that kind of, you know, hearing that, you know, with the humor with everything, but enjoy life. But, you know, our biggest thing is, you know, it's on my shirt. Men have breasts too. You know, the other thing was our first slogan for the Brett Miller 1T Foundation was for men to don't be afraid to touch yourself. So, you know, speak up. Don't, you know, if something's wrong, go to the doctor. It's just trying to get the stigma for men of being stubborn gone, and to take care of yourself. Because if you're not there for your loved ones, then, you know, somebody else, you know, will have to, and that's not, you know, it's just what it is. So don't be afraid to touch yourself, and men have breasts too. So thank you.
Thank you, Brett. Thank you. And again, humor is always necessary. So thank you for that. Dr. Spencer, what's the one piece of advice you would like for viewers who have either, you know, gone through the process, they've been diagnosed and they're living through it, and those who have yet or have not been diagnosed? What are some tips some takeaways you can give those people that are watching?
Oh, sure. For those that have not been diagnosed, I would say just be mindful of the ABCs. A is awareness. Be aware of your anatomy. If you see something, say something. You notice I didn't say feel, because it's not always a lump. With Brett, it was a lump, but with others, it may have been nipple inversion, nipple discharge, etc. But if it's something different, make sure you say something. The other thing is just to be aware of not only your anatomy, but the guidelines. Screening mammogram starting at age 40. And for men, just be mindful of your anatomy. And so if there's something different, make sure you let someone know right away. B is behavior. You know, we can't change our age, we can't change our family history, but there's things that you can do to be proactive to lower your risk. And a big part of that is making sure you're exercising, making sure from a mental health standpoint that we are checking in with our strong friend, and that we're checking in with ourselves to make sure we have psychosocial wellness. If you're feeling anxiety, depression, undiagnosed or undertreated bipolar, make sure you are seeking professional help to manage that. Also, C is just our consumer choices. You know, every time you sit down to eat, you're either feeding or fighting disease. So just be ever diligent in putting good things in our bodies and on our bodies. 85% of, you know, our skin is our biggest organ. So be mindful of what you're putting on your skin. Read the labels. And so those are the ABCs in terms of what to look out for if you have not yet been diagnosed. In terms of those that have been diagnosed, whether it's male or female, I say you may have cancer, but it doesn't have you. And as Jennifer mentioned, very frequently it's temporary. And I've had so many people that have died out of fear of the treatment and the side effects. You know, they'd rather lose their hair than they'd rather lose their life and lose their hair. And so it's temporary. You can get through it. A bump in the breast is a bump in the road. You go over it, you go under it, you go around it, but you get to the other side. And very lastly, something that gives me like great confidence and inspiration, it was by Arthur Ashe. And what he said was, every day, regardless of life challenges, you start where you are, use what you have, and do the best you can. So I would encourage people to do that. Start where you are, use what you have, do the best you can. You will get through it.
I tell you, this has been such an inspiring episode for me, you know, and I hope for you as well, those of you that are watching. It's not too late to schedule your mammogram. In fact, write yourself a note tonight to call on Monday, get it scheduled, do your self-checks. It's not just a women's disease. Men have breasts too, as Brett has reminded us this evening. Please check your breasts. It's important. It can save your life. Thank you again to my guests tonight. I've thoroughly enjoyed this conversation. Come back next Saturday, same time, same place, for Living the Sweet Life, Surviving Breast Cancer and Living Life to the Fullest. I'm excited again for that conversation. We'll hear from a breast cancer survivor. She's an entrepreneur. She's been featured on the Food Network. So we'll be bringing her your story. We'll be bringing you her story next week. Thank you again to Brett, to Marilyn, to Donna, Jennifer, and certainly Dr. Spencer for taking time to share information, inspiration, and empowerment with us. Thank you guys for watching. We'll see you next week. Bye-bye.
Thank you for having me.